Hi, welcome to You and Your Health. I'm your host, Dr. David Bertone. Today's show is about eye disease and vision care. I can tell you there's a lot of new technology out there to help people see better and to also determine what's happening in terms of their eyes to hopefully prevent eye disease from becoming a serious problem. Our guest today is Dr. Steve Silberberg. Dr. Silberberg is a board-certified optometrist, and his practice is located in Mattawan, and it's called An Eye to the Future. And I can tell you, it is one of the most technologically advanced eye practices I've ever been associated with. Dr. Steve, welcome to the show.
Well, thank you for having me here, and thank you for the compliments, firstly. I'm glad to be here, and I'd like to answer any questions you have, and hopefully we can continue.
Great. Tell us a little bit about your background and how you got involved as being an optometrist.
Well, the brand that I have of the Eye to the Future, I had a circuitous process. I went to SUNY undergraduate at Stony Brook. 4 years. I graduated number one in my class and went off to MIT to be an astrophysicist, and I did that for a couple of years. Realized it wasn't the greatest profession. It was a great advocation, but not a great vocation, and decided to look for something to do in science that was going to help people and also be a little more practical. I went to professional school for 4 years, graduated from SUNY optometry, again as valedictorian, and I've been in practice in Mattawan for 17 years now, and again, our practice has been noted as one of the highest tech practices in the country. We just recently had a journal article written about us because of that, so
awesome.
We're very proud.
Great. Well, welcome to the show. We're going to start briefly about the anatomy of the eye, and I think it's important for people to understand what the eye is made of in terms of all the different components, so you get a little better understanding about how vision works.
Sure.
So can you show us on your your iPad? That'd
well,
be great.
See, I'm a Yankee fan. I apologize for that. Now, and I thought the best way of doing this is to take a tour of the eye, of how light enters the eye. When light first enters the eye, excuse me, let's get the anatomy up here. Light goes through our cornea, which is a clear tissue, and we don't actually see the cornea, we see the iris behind it. So light goes through the cornea, hits the iris could be blue, brown, black, etc., and then hits the crystalline lens, which focuses light. Light focuses on the back of the eye, called the retina. Now, the retina is part of the brain, very, very important, because this takes the picture to see, and it gets transmitted via an optic nerve to the brain processes the images. That's basically the basic anatomy. All parts of the eye can go wrong, and we have treatments pretty much for all those things. Okay.
Now, when we talk about some common vision terms, I think you're going to show us here. What would nearsightedness be? People have heard the term nearsightedness. What does that mean?
Just like when you take a picture with a camera and the camera's out of focus, it can be out of focus for various reasons. With nearsightedness or myopia, light comes to focus in front of the retina, and contact lenses or glasses just bring it onto the retina, just like a picture would be taken properly. When somebody's farsighted, the image goes behind the retina, and various glasses or contact lenses brings it on the retina also. There's a more complex condition called astigmatism, where there's two focal points. Not important to mention the complexities of it, but again, glasses or contacts can correct for that. The other condition that people are a little bit understanding is something called presbyopia. Presbyopia is not farsightedness. Presbyopia means at a certain age, 43 to 45 is typically the age people need reading glasses. They can need reading glasses if they're nearsighted, if they're farsighted, or if they're astigmatic. That's not a very common problem. It's a universal problem. I think several people in this room that we're looking at have that problem at this point in time. So yes.
So it's natural for people as they get older,
yes,
where the light is going to come through, where it can be focused, is what the problem really is, right?
The problem is exactly what you said. This structure here, called the crystalline lens, changes its shape. As we get older, it gets a little stiffer every single year. So a 5-year-old might be able to make things clear here, 10-year-old here, 15 here. Right around the age of 43, it's the place we hold things, and the stiffening of the lens doesn't make it change its shape as readily, and that's why we need glasses to help us out.
Great. All right, let's talk about the components of an eye exam. So somebody comes to your office for the first time. You can put that down if you like. Somebody comes to the office for the first time. What is it that really is involved with examining their eye? Take us through
Well,
the process.
certainly it might be different at different ages, but let's do the basics. The first thing we want to know is the eye healthy? And we're going to look at the front of the eye, called the cornea. We're going to look at the retina. Now, the retina tells us a great deal about the eye, but most importantly tells us a great deal about the body. We can pick up things like hypertension, diabetes, a high cholesterol, and various other blood abnormalities by looking at the retina. So that's the basic, most important part of the eye exam. People focus on how their vision is 20/20, for example, and I'll say a few words about that right after. But certainly we check their refractive status to make sure they're seeing well, and if they're not, we'll advise them certain things they can do. So a complete eye examination should include a complete eye health examination of the front, middle, and back of the eye, as well as refractive status analysis. And for children, it's very important to examine their binocular vision. Children have problems in schools, not only because they just can't see, but because their eyes don't work well as a team. So they might have reading problems, etc. And those tests are more comprehensive. So an eye examination should not take 5 minutes. In our office, we schedule between a half hour and 45 minutes, and for learning disabled people like you, Dave, we schedule a little bit more time, knowing that that would be the case.
So you're looking at the inside of the eye, obviously, and when you're looking at the vessels, you can tell if there may be some disease going on in the rest of their body. In terms of health and wellness, it sounds like a very important exam that should be done yearly.
Yearly, but to be practical, I think children should have it done at 2 years old first, then 5 years old. Adults, in the 30 to 40 age bracket, they're pretty healthy. If they didn't have a problem beforehand, every 2 or 3 years is fine. After the age of 40 to 45, every year. Certain systemic conditions, if somebody is diabetic, they can be seen much more frequently, obviously.
Okay. Now, we talk about technology. I used to go to the eye doctor and they dilate the eye and you can't see for a couple of hours, and I know the reason is because you want to be able to see everything, right? Now, you go to your office and you have like 8,000 machines and computers, and you can just tell what's going on with the eye. So what is technology? How has that really helped you?
Well, it's helped me. I've changed from becoming a data collector to a data analyzer. So when somebody comes in my room, I pretty much know what's happening with that case before they come in the room. Now, having said that, there are a few cases that we still dilate people. If somebody has a cataract, which is a cloudy lens, and I can't see, I might have to make the pupil bigger to see around. But those are the rare cases. So when they come to our office, basically the instruments help me, and then I verify certain things, and we spend most of our time educating people about what we found. So it becomes a lot easier to examine the eyes. And if I practice the way I practiced when I first started practicing, I tell you, it was like nice and bearskins. I don't know how I did it. We did a good job for what we had in those days, much like physical therapy, orthopedics, cardiology, etc. But it's a totally different world, and it's an exciting world. And people love it because, as you know, I'm an educator as well as an eye doctor. So when people come, I explain to them what's normal for them if they are normal, and what I could see if it's not normal. That's why those yearly exams are great. And people love it because they learn about their eyes. We'll get a little later into some of the more technological things that we can do, but they're very, very, very impressive that we can do nowadays. And this week, more things have come out than have come out in the last year, and we'll discuss them a little further later.
Excellent. All right, so we're going to talk about some of the major causes of vision loss. Obviously, people can lose their vision. It can be very devastating. And when you're doing your exam, you might be able to pick up early signs of some of these things, and there's some treatments available for them.
Correct.
So let's talk about diabetic retinopathy. So that's the diabetic patient. Has obviously issues that can develop into eye disease. Tell us what that is.
And most importantly, if they don't keep their sugar under control, those issues will develop more frequently. When the diabetic patient has problems, typically it's in the back of the eye, the retina bleeds. Just like, similarly, if we have problems in the back of the eye, they probably have problems with their cardiovascular system, their kidneys, or peripheral neuropathies. So the key thing is finding these things early, because unlike many, many years ago, we have tremendous treatments for these things, and with our proper instrumentation, we can intervene early in the cycle, prevent vision loss with various techniques, whether they be lasers, whether they be oral medications, whether they be steroids. And most people, if they keep their sugar under control, will not go blind from any of the conditions we're going to speak about, including diabetic retinopathy. But the patient has to be part of the equation with diabetes with respect to other conditions.
Obviously, management's important. But what's happening with that particular condition that causes their vision to be lost? Is it
Okay.
a nerve?
No,
It's not functioning as blood supply?
It's the blood vessels. The blood vessels have certain changes in the way they are. The blood vessels called histology, and they leak fluid more frequently. And the fluid contains blood. The blood will scar, and the areas of the retina, which is part of the brain, will die.
Okay.
And the whole idea is to catch that in the early stages, prevent that from scarring, and they're essentially normal at that point in time.
And what is macular degeneration?
Now, people think when they have macular degeneration, they go blind. Nobody goes blind from macular degeneration. The macula is the area, when I'm looking at you, that central 5-degree area I'm looking at is the macula. That's the part that sees the most precisely. Unfortunately, in a great many people, as they get older, the macula leaks fluid, has a very rich blood supply. And again, intervening early, there's brand new treatments. It sounds hard, but it's not a very painful procedure, where they inject a drug called Lucentis into the eye to divert. This drug was originally invented to cure cancer. Tumors have blood vessels, and by suppressing the blood vessel growth, the tumor would shrink and die. And it's still used in cancer therapy, not to the success they thought they would have it. However, in the eye, it seems if somebody's eyes are bleeding in the back, and we can catch it very early when there's no vision loss at this point at all, and at that point, inject the Lucentis, maybe use some steroids, and the vessels regress and the person doesn't lose vision. We're even getting back vision on patients who've had macular degeneration or seeing maybe the biggie on the chart, and they're coming back to better vision. But let me make it clear. I'll give you an example. One of my patients has a juvenile form of macular degeneration, and he's about 47 years old now. He's an accountant. He drives an EMS vehicle for Edison, and he has telescopes on the top of his glasses. He's accepted it, and he's lived with it because he had it at a young age.
Accommodation.
Exactly. So he's normal as far as he's concerned, and other people are normal. The problem with that, some of these diseases we're talking about, they happen at the worst time of life as people get older and they can't accommodate to these things.
All right, glaucoma is another big eye disease. Tell us what that is and what's available to treat these people.
If I gave that answer 20 years ago, it would be glaucoma is pressure in the eye that's causing the optic nerve to die. Throw that away. Glaucoma is where the nerve is dying from various reasons, and pressure is just one of the minor factors of it.
Okay.
We now know, and this is recent studies over the last 2 or 3 weeks, certain changes are occurring in the brain that occur also in the optic nerve. They just don't become clinical, meaning the person doesn't have any problem in the brain. And it's thought that glaucoma is really a neurological disease that actually affects the optic nerve. We intervene by lowering the pressure. Now, I have hundreds of glaucoma patients. The medications are fabulous. The treatments are fabulous. The diagnostic testing is fabulous. And as long as they maintain their visits, we find that essentially nobody is losing their vision. Glaucoma is a treatable condition. Consider it like hypertension.
Okay.
If you do it right and the people do the things they're supposed to, people will not lose vision from glaucoma. And even when we see progression, there's other things we can do, more serious surgeries, but we like to reserve that for the end point.
Sure.
At this point, glaucoma is a nice disease to treat. People are happy because they're not losing their vision. So we put that arrest as a blinding condition as it was 20 years ago.
That's exciting.
Yeah.
The last major cause of vision loss that we're going to talk about is cataracts. It's fairly common as you get older.
Yes.
What is a cataract and what is the treatment for
Think
it?
about that lens that focuses light that we talked about in the past. The lens gets stiffer. Well, if we use an analogy, every year after about the age of 65, and it varies from different people in different ages and different medical conditions, drop a little drop of milk into that lens. So every year it gets a little cloudier because it's protein. And just like an egg when it's hard-boiled, the white of the egg gets nice and thick and you can't see through it. The exact same thing happens with a cataract. So the proteins, instead of being nice and straight where you can see through it, get cross-linked. And it's not a disease, it's a condition. If we all live long enough, we all will develop cataracts. The thing is, the removal of the cataract 25 years ago used to be a 4-day hospital stay and a very, very serious operation. Now it's a 15-minute operation done usually in the doctor's office. The initial part is even done by lasers now, and there's tremendous advances. Very quickly, they take the cataract out and they put an implantable lens in. But now we have implantable lenses that are bifocals, that correct astigmatism. So people are thrilled to have cataract surgery because it's like having free LASIK surgery. It's covered by insurance, of course, and I could choose the prescription I want them to have afterwards, so it actually becomes a win-win proposition. The doctor does well, the patient does well, and the people selling the lenses do well. So it's actually a happy experience, cataract surgery.
Sounds good.
Yeah.
Great. Okay, so when we come back, we're going to talk about some of the technological advances in improving your vision. Again, our guest is Dr. Steve Silberberg, and we're talking about eye disease and vision loss.
Alzheimer's disease, if left unchecked, will strike millions, including baby boomers, their children, and grandchildren in the coming years. As a scientist studying Alzheimer's disease for the American Health Assistance Foundation, I'm well aware that continued research is our only hope for finding a cure. Call 1-800-437-2423 or visit ahaf.org for free publications on Alzheimer's. Learn what you can do to help battle this deadly disease.
Hi, welcome back to You and Your Health. I'm your host, Dr. David Bertone. Today's guest is Dr. Steve Silberberg, a board-certified optometrist, and we're talking about eye disease and vision care. Thanks again for joining us, Dr. Silberberg.
Still my pleasure.
We talked about in the first half about some of the common diseases that may cause vision loss. Let's talk about some of the corrections that are available from your end. You can help people if they're losing their vision.
Okay, firstly, like I said before, there's very many medical treatments for it. In diabetes, we have the laser treatments. In macular degeneration, we have many treatments from laser onto other more exotic treatments, but they all seem to work well. And the biggest advance that's happened in the last couple of weeks is they're now doing stem cell transplants for macular degeneration over at Wills Eye. I got my second patient into it. So we have the potential to cure this disease going forward. It worked in chimpanzees, it's worked in rabbits, and essentially you know how stem cells work. Not getting complex, we have the potential to cure that disease. Cataracts are, again, something that we have pretty much under control, and glaucoma, as you know, we have pretty much under control also.
Wonderful.
As far as the optical aids, when somebody does have subnormal vision, I was director of low vision at Robert Johnson for several years, and there's many aids as long as the patient's attitude and abilities to use these devices are great, whether it be telescopic aids, whether it be reading aids, and simple aids around the home. A complaint that I might have, for example, is an elderly person can't sign a checkbook. Now, they don't need special glasses, they need a template, something to put over a check, and they can sign the check, and they feel more independent. So it goes from the very fancy optical aids to the most simplistic aids that you can have for people, whether it be lifestyle aids in the home, even tagging the refrigerator that it's red and the stove that's green so they don't use the wrong devices. So it runs the gamut, and we could talk for 3 hours on it, but it's just a very, very robust field at this point in time.
Great. Now, the majority of the population will come to you for vision correction.
Correct.
So they're having trouble either seeing far or having trouble reading. What are some of the options available for them? And let's talk first about eyeglasses.
Okay. And eyeglasses, certainly, we have that down pat. However, it's going to change in the future in eyeglasses and contact lenses. When we think of 2020, we always thought that was perfect vision. It's not. 2020 just means good, solid vision. And it means what you see at 20 feet, the average person sees at 20 feet. The retina has the ability to see 20/5, meaning we could see at 20 feet what the average person sees at 5 feet with certain technologies. It's almost like the pixels of the camera. And we're now developing eyeglasses and contact lenses that'll have the ability to make people see that. We're not talking about 30 years from now. So both contact lenses and eyeglasses correct astigmatism, correct nearsightedness, correct farsightedness, but there are other things that light does wrongly to the human eye, or the human eye does wrongly to light, that the space telescope was set up for, that we can now do pretty much clinically in the next couple of years. So we're going to be thrilled. People are going to get glasses who see perfectly because they'll be able to see more perfectly.
Yeah, I was just going to say that. You can have people that see well and they'll want glasses and they'll see even better.
Yeah. And as you know, contact lenses have had great advances in terms of the health. I'm not a big fan of patients sleeping with lenses. There are lenses that are out there that can sleep with for a month. The statistics are that 11 times more risk factors and some serious illnesses occur. So I would be a little reticent to fit people for extended wear for long periods of time. The contact lenses are getting better. Astigmatic contact lenses are great. Astigmatic glasses are great. And we have some new high technologies that hopefully we'll take a look at a little bit later on.
So when you talk about the astigmatism and the treatment for that, just refresh the audience again. What's happening with astigmatism? It's a focusing issue?
Not a focusing issue. Astigmatism means, again, let's use this device here. The front of the eye, called the cornea, instead of being shaped like a ball bearing or a ping pong ball, is shaped more like a football. And the astigmatic glasses or contact lenses have the opposite shapes of those, so they bring those two focal points, as we discussed earlier, into one focal point, and they're quite good in this day and age. Glasses always were easier because the glasses stuck on your face. Contact lenses will rotate in and out of place, but the newer ones are very, very stable, and they correct the astigmatism better. People can have astigmatism with nearsightedness, they can have astigmatism with farsightedness, they can have astigmatism with presbyopia, all those other conditions we talked about. So in and of itself, it's a separate condition that allays the other conditions we talked about.
Okay, and they're all treatable with eyeglasses, or now the technology is the contact lens.
Contact lenses.
And there's a lot of advances. Let's
Yes.
talk about the advances in contact lenses.
Well, for example, now the materials are so much better, they're so much more oxygen permeable that people can wear them so much more effectively for longer periods of time. Also, the optics are better than them, and they can see better with them, and that's obviously one of the reasons to get them. There's some newer lenses out there that I'm starting to use that give people even better vision. One's called the synergized lens. It has a hard lens center and a soft lens skirt, so it looks like the planet Saturn. Now, because of that, the hard lens center gives them good vision, the soft lens skirt gives them great comfort. So now we can correct astigmatism even better, and pretty soon they're going to come in multifocal form, Dave, and maybe we'll work that with you. I do a technique, and this is a technique, it has to do with vision, but it has to do with going forward vision. Children who are myopic usually get worse and worse every single year. There's a new technique called CRT, or corneal refractive therapy, where they wear a contact lens at night. It reshapes the eye, and they take the lens off in the morning. They see well all day. That's great in and of itself. However, all the studies seem to show that it slows or stops myopia completely. So people are coming into me with their kids at 8 years old to get this procedure done so they don't become a very high prescription like their parents are. And it's just a wonderful thing. And to give you a plug, my own partner is doing his son now, and he's fabulously successful. So it's a really new technique, and there's other new techniques out there, like I just mentioned with CRT and synergized lenses, and they run the gamut, but we're getting better and better. A progressive practice will tend to use them. Older practices will tend to incorporate them years down the road. So we're a little bit more in the forefront of that.
So are you still using hard contact lenses? Is that still available, or is it recommended for patients?
If you divide it up into hard and soft, hard lenses don't exist now. We use rigid gas permeable lenses, which are as healthy as the soft lenses.
Got it.
Perhaps not as initially comfortable, but as far as all the other old hard lens issue problems, that have gone by the boards with these new gas permeables.
And you say, not to sleep with them. What about things like going in a pool or going in the ocean or things like that? Is there danger associated with that?
Not a danger. If the pool I worry about because of the sterility of the pool, but if all things being, if the pool has a good chlorine system, the only problem you have is loss of lens, because the lens stays on your eye via surface tension. So if the lens is on your eye and there's water on both sides of the medium, it could fall off your eye, and that becomes more of an economic issue. But with a clean pool or the ocean, very little chance of an infection.
And how long do contact lenses typically last now? So you put them in and you take them out every night, as you say. When should you change them?
It runs the gamut. There are lenses that last for 1 day. They're made to last for 1 day. Okay. They work well. They're very comfortable. The trouble is there's a lot more expense involved when you're getting 720 lenses a year, 730 lenses a year. It's at 365, except this year it's 732 lenses. That's one way of fitting it, but a lot of people don't choose that. So typically the average good disposable lens, which most people use in this day and age, lasts between 2 weeks and 1 month. And 1 month is just about the average time. Okay. Now if somebody's a partial wearer, they can wear them longer than that. There are lenses that last for 6 months, but again, those are the older lenses, and we tend not to use them in this day and age.
All right, we're going to talk about some really cool advances with vision correction, and one of them is with a pair of eyeglasses that you brought today. And this is called the Empower system, I believe, right?
Now, if you look at them, they look like a regular pair of glasses, And if anybody's gotten a multifocal lens before or a regular bifocal, you know there's problems inherent with it. When you put them on and you look down, the floor is blurry. If you play any sports, you really can't play with them because it's just very, very
So when you say
distorting.
multifocal, you're talking about a lens that will help you see far and then also has the bifocal.
Right. Usually somebody
Okay.
over 45 years old with
Okay.
this. And what this glass does is fantastic. What it does, it has electronics in here, and the engineers have figured out a way. If I want to do this, the lens when I look far away is for distance. I look down, it's for reading. Or if I want to make it so that I only want distance, I just press it in. And then I'm driving around, I'm playing golf, and I don't have to worry about the reading prescription. If I only get 1s and 2s in my scorecard. You know I'm a very good golfer. But if I want to see whether I drive right a 1 or a 2, I'll put this in and do it that way. Perfect other example, this is my own personal lifestyle. I'm watching TV, and I'm laying on the couch like this. Now, progressive lens, half the TV will be blurry, half is clear. So I swipe it off, single vision, boom, my TV's clear, my computer's over there, pop it in, I go on my computer. So it has a lot of flexibility and modularity. And this is a first-generation product, yet it's working very, very well. It's from Pixel Optics. If somebody wants to go to the site pixeloptics.com, they can look at it more, but it just works very, very well. I'm nearsighted, so I'm lucky enough to, I won't get too complicated, but I can see up close pretty well without glasses on. But a great device, and this is going to get, going forward, more and more devices are going to come out like this. Contact lenses are coming out also that do several things. There's contact lenses that are used for medicine now, and Johnson & Johnson's just got one approved where medication for glaucoma for people that just can't put the drops in their eye efficiently because they're older and they don't have any support. The medication's in the contact lens and it's time released. And going forward just a few more years, we might have contact lenses like Terminator, where it has all the electronics in the lens and you're looking far away at regular things, but you're getting feedback on the environment. And that's not too far away. They already have it done in the prototype stages. And so this field is so exciting because of all these things. And I'm a high-tech geek as you have it. So I would love to see what these look like.
Yeah, I just read something the other day that Google is coming out with a pair of glasses. It's going to have the computer and web browsing based right into it.
You just worry about when people drive a car,
Yeah,
but
I mean,
we'll worry about that then.
The technology is incredible.
Yeah.
Let's talk lastly about some of the surgical procedures, and one of them is called LASIK to correct vision. We're gonna show a video about that. So tell us a little bit about this video that we're going to see.
Okay, LASIK is obviously the most common performed surgery because it has the least problems after surgery. People should realize, though, that LASIK is not 100% successful. It's successful, but people will have a little tiny prescription most of the time afterwards. They're very happy, but sometimes they still need a mild vision correction for driving, or they have another enhancement, another surgery to do so. When LASIK is done, essentially a blade comes across the eye, which takes away the skin of the front of the eye, because you don't want to lase that, it would cause a lot of inflammation. Then the laser will lase the eye and flatten the eye such that that focal point that we discussed earlier comes back on the retina, and they see very, very well. Most people are very, very happy. People have to realize, though, after the age of 45, if we make your eyesight perfect far away, anybody 45 to 50 years old still needs reading glasses. So LASIK cannot correct distance vision and reading vision for that older population, and they still need reading glasses.
So can you still get it as you get older, but you'll still need reading glasses? Is there an age limit to doing LASIK?
No, we have LASIK on 70-year-old patients. They've done beautifully. And they do have limitation in the younger population. It should be over 18 years old and have a stable prescription. You don't want to do LASIK on somebody and 3 years later they get more nearsighted just because they're in school and they're studying very, very hard.
Okay, great. Is there any other advances that you can think of that are really helping people these days see better?
Okay. The biggest advance, as I said, is this new technology called wavefront optics. Again, to measure other deviations that the human eye produces that we can now measure, and we can make pretty soon glasses and contact lenses that will make us pretty much bionic. Now, this has always been a problem in the human eye from caveman times. We just couldn't correct for these things. We can measure them very precisely, and we're starting to correct them precisely. So it's a wide open field as far as that's concerned, as far as vision's concerned, as far as diagnostics and treating of eye disease, The stem cell stuff I just mentioned is a panacea for all the diseases we mentioned, including glaucoma. So if we have the potential to give people the best vision possible, to really take those 4 diseases and make them a chronic condition that never will cause blindness, I think our field is a very happy field going forward.
Very good. Well, thanks for joining us today.
My pleasure.
Really appreciate it. Our guest today is Dr. Steve Silberberg. We talked about eye disease and vision correction. Welcome again to You and Your Health. Again, I'm your host, Dr. David Bertone. Thanks for joining us.